endocrine system. Pituitary gland. Pituitary gland is connected to what part of the brain by the infundibulum? What does it connect to?
The pituitary gland?
Yep. Connects to the brain by the stalk called the infundibulum. What does it connect to? In other words, the infundibulum connects the pituitary gland to the blank. That'll be a question on your final, actually. Hypothalamus. Remember, we did the pituitary gland, right? Yeah, we just did the endocrine system. The hypothalamus connects to the infundibulum to pituitary gland. Pituitary gland has an anterior and posterior part, the adrenal hypophyses and the neurohypophyses. 7 hormones from the neurohypophyses, 2 hormones from the adrenal hypophyses. Okay, and it connects by the infundibulum. There's the pituitary gland. You can see where it's situated right there. Remember, it connects to the hypothalamus, that stalk. And what's the name of the bone that surrounds it? Remember, it encases it and protects it. It's part of the sphenoid bone. It's a sella turcica. It's a bone that comes around and encases it. It forms a hard bone, like a C-shaped encasement around the pituitary gland. You can also see the optic nerves. Okay, remember the optic nerves come down and it crosses into the optic chiasm right behind the pituitary gland. Goes in your optic tracts. Okay, into the cerebral cortex, into the lateral genicular nucleus. And you got 2 quadrigeminis. You got 4 bumps right behind that. Remember? I'm going to word this. There's 2 that are responsible for auditory and 2 responsible for visual. What are the ones responsible for auditory, for optic nerve, for visual, I'm sorry. The optic nerve goes to the superior colliculi. The auditory nerve goes to the inferior colliculi. And those broadcast in. And then it goes to the lateral genicular nucleus into the occipital cortex for the optical nerve. We did this, right? It should sound somewhat familiar.
Oh, for some of us, the power went out like on 3/4 of the way through. So.
Okay.
Yeah, I was wondering where you went.
Yeah, I know you disappeared on us. Yeah, Alexis was saying the power went out like several times already this whole week.
Yeah, this month it's gone out 7 times. They've had in the past month and a half, 2 months, they've had, I think, like maybe 7 or 8 planned outages to fix these problems. And this was Sunday was like the 26th or 27th power outage since January 1st.
Yeah.
And they've been roughly around anywhere no less than 2 hours.
I don't know about you guys, but the wind here is crazy. So mine kicks off every now and then just because of that.
No, this is like out. Like you have to call USAA to get money back for your food.
I told you we were living our best lives here. I'm just saying, no power for 50% of our week.
You guys getting an RV and start living out there.
Last thing, no, even the RV park is out. It goes out.
God.
Last Thanksgiving, we were without power for, I think, 15 hours.
Wow.
On Thanksgiving Day. All of our Thanksgiving food was ruined. Like $200-300 worth of food.
Oh, man. That's crazy. Like you need that generators on those RVs to pick up on the electrical power there. All right, so that was the pituitary gland, the optic nerve, and the tuberous cinerarium. That is it's a depression in the brain as part of the hypothalamus. It's more of a landmark than a kind of structure. All right, side view. Okay, there's a hypothalamus. You can see the blue area there. It's your hypothalamus. Just above that is your thalamus, which is the H-shaped thing right above it, right in there. Okay, pituitary gland connects to the hypothalamus by the infundibulum. Pituitary gland releases hormones into the body. Pineal gland. Pineal gland is just distal or posterior to the thalamus. I need that small gland. How did I lose my picture already? There we go. All right. The pineal gland. I'm sorry, I said pituitary. The pineal gland is just distal to the thalamus. Okay. What's the pineal gland responsible for?
Melatonin.
Was that?
Melatonin.
Melatonin to control circadian rhythm. That'll be on your final also.
Is this guy missing all his teeth?
Yep.
Well, he is dead, so.
Yeah, but he was missing before that too. You can see the sockets are all healed in. If you want to get a close-up of it. Yeah. You can see where the teeth would be here on the side. They should be right in there. You might have a little one right there. I can't really tell. But for the most part, it's missing the teeth. Because you're only taking a sectional view to the side. So, but there should be an incisor right here. Okay, but you see the mandible right here. This is all mandible. And there's no teeth on it. So he or she is missing teeth. Okay, thyroid gland, your thyroid, just below your thyroid cartilage. Okay, and it sits as it's a butter-sized structure. How many lobes does a thyroid gland have? 2. Perfect. What connects them? What's the connection called of the thyroid gland that connects the right and left lobes?
Isthmus.
The isthmus. Perfect. Okay. The isthmus thyroid gland connects the 2 lobes. Behind the thyroid gland, there's 4 little nodules. What are those called?
Parathyroid.
Parathyroid glands. All right. Perfect. So you got the hypothalamus, pituitary gland, pineal gland, and the thyroid gland. Okay. Look at the rest of it. You see the thyroid gland still up at the top? Okay, just below the thyroid cartilage. And the thyroid gland is anterior to the trachea. Okay, so it sits in front of the trachea. You can palpate your thyroid gland. You can feel it. It sits in front of your trachea. Okay. You have a right adrenal and a left adrenal gland. In the book, they're called suprarenal glands. Same thing. Adrenal glands are also called suprarenal glands. And you have a right testes and a left testes also. Okay. All those produce different hormones that circulate through the body as part of the endocrine system. Okay. Here's your thyroid gland. Okay, you see there is the right lobe. There's the left lobe. Okay. And in between the 2 is the isthmus that connects the right and left lobes of the thyroid gland. Okay. On the sides of the thyroid gland, up near the top, the superior portion, you'll have what's called the pyramidal lobe. There's a pyramidal lobe on the left and on the right. And it's just the superficial part of the most superficial portion of the thyroid gland. And it's called the pyramidal lobe of it. Okay, this is a view that's been cut through it, so you can see the thyroid cartilage. Everything's been reflected. The rest of the neck's been reflected away from it. So you see your Adam's apple there, and you see the thyroid gland and your thyroid cartilage. Okay. Thyroid cartilage is this thick piece of cartilage right here. Okay, that's what protects the thyroid gland. And the thyroid gland sits underneath it. You can see the butterfly shape of the thyroid gland. Okay, you see the right side, the left side, and the isthmus that connects it. So that's your relationship with the thyroid cartilage to the thyroid gland. Okay, there's your heart. Remember, the heart is responsible for ANP and BNP. Okay, those are 2 hormones that are released by the heart to help regulate the body. We haven't gotten to the heart yet, but I think that's the next chapter. The heart has 4 chambers. It has 2 atriums, 2 ventricles. So you have a right atrium and a right ventricle, a left atrium and a left ventricle. The atriums are the top portion of the heart. Okay, that's where blood flows into. Then blood flows in from the atrium into the ventricles. From the ventricle, get pumped out to the rest of the body. Your right ventricle pumps to your lungs. Your left ventricle pumps the entire rest of the body. Okay, and like I said, we haven't gone over that yet, but we will. We'll go to the heart in great detail. I think there's 3 chapters on blood in the heart. You'll become experts at it. Too much, too far. There we go. All right, here's the stomach. The stomach usually lies flat down. So this area here is usually where my circle is. That's usually where the stomach lies. They pull the stomach up and reflect it upwards. So there's the stomach. Okay. Then the big, huge organ up on the top your top left-hand corner is the liver. Okay. And the funny shaped thing down here is the pancreas. See how it's a long, kind of like a, I'm not sure what kind of shape it is, like a conical shape that are going across there, where it feeds into the duodenum here and then extends out. And extends all the way to the tip of it. You see this organ right here, where the circle is? What's that organ? Remember, the pancreas extends all the way, the tail of the pancreas extends all the way to this organ. It's the largest lymphatic organ of the body. What would it be? That would be your spleen. This is your spleen right here. That's your largest lymphatic organ in the body. And the tip of the pancreas, the tail of the pancreas, extends to the spleen and extends to the other opposite end to the duodenum of the stomach. Okay. Remember, the pancreas has exocrine and endocrine functions. It has exocrine because it releases into the duodenum of the small intestine, and has endocrine because it releases into the bloodstream of insulin and glucagon. Okay, so it's one of the few organs that has both exocrine and endocrine functions is your pancreas. So again, you have pancreas, your stomach that's been pulled up, and then the liver. Okay. Adrenal glands or suprarenal glands. You can see your kidneys. Kidneys are obvious. Okay, right kidney, left kidney. Above each kidney sits an adrenal gland, a left adrenal gland and a right adrenal gland or suprarenal gland. Okay. There's 2 layers of the adrenal glands. What are they? The outer layer is called the what? I guarantee you'll see this on your final. I've been working on writing your final. So what's the outer layer of the adrenal gland called? It's the cortex. That's its outer layer. What's the inner layer of the adrenal gland called? Remember, organs have 2 layers. The outer is the cortex.
Medulla?
Perfect. Inner layer is the medulla. Okay. When the adrenal gland is stimulated, what hormones does it produce? They come from the medulla of the adrenal gland. What 2 hormones come from the adrenal gland?
Epinephrine and norepinephrine.
Perfect. Epinephrine and norepinephrine. Okay, that's your sympathetic nervous system. It stimulates it. Okay, to produce epinephrine and norepinephrine. It increases your heart rate, increases your breathing. It produces your fight or flight response. Good. Okay, again, this is the kidney. You see all the different structures inside the kidney. We'll go over those. Are one of the next chapters coming up. We're going to the kidney. Okay, we go through all the different channels, all the different canals there, and how it filters the urine and everything else in the kidney. But this is just a kidney, and on top of the kidney sits your adrenal gland. And the adrenal has a cortex and a medulla for the adrenal gland. Okay, you have the penis. for the male reproductive system. You have the testes, where the sperm are formed, and the epididymis, where it's delivered out from the testes up into the canals. So your testes you have down here, and the epididymis is this cord that connects it up into the vas deferens, up through the testes into the tubules. Right? So you got the penis, the testes, and the epididymis. And there's only one more slide for this. This is the female reproductive system. You see the two little eggs in the back there, little egg-shaped structures. Those are your ovaries. Okay, so you see the right ovary and the left ovary. Okay, and then you have the right uterine tube and the left uterine tube. Okay, the left uterine connects the ovaries to the uterus. Okay, a uterine tube is the same thing as a fallopian tube. They just changed the name. If you learn it as fallopian tube, it's the same thing. Okay, so you have a uterine tube that connects it, and then this here is your uterus, connects into the uterus. You see the uterus sitting right here, where the circle is. Okay. That is all the structures for that. So let's go to our quiz. We'll see how much you guys remembered here. I'll turn off the highlights for a second so you can see it. All right. So which structure is being highlighted here?
Adrenal gland.
What's that?
Adrenal gland.
Adrenal gland. Here's the kidney. Here's your portal system where the blood is coming into the kidney. Okay. This is your kidney. On top of the kidney sits the suprarenal gland or the adrenal gland. Okay. Which organ is highlighted here? I'll put the highlight back on. You see that's that whole organ that sits right there. Okay, you get a good look at it sitting right here. Has a head, a body, and a tail. Okay.
Pancreas?
What?
Pancreas?
Pancreas, perfect. That'd be your pancreas. Okay. It's a tube-like structure. Remember, it extends from the small intestine, where it actually has ducts into the small intestine, into the duodenum of the small intestine, extends across, and all the way extends to the tip. The tail end of it extends towards the spleen of the body. And here you can see the liver, see the stomach reflected, and that is your pancreas. Okay, again, the neck's been reflected. You can see your trachea right here. So here's the trachea. So this is in front of the trachea. You have a gland that sits right here, and you have this mass that sits on top of just a superior to that gland. So first of all, what's this gland right here?
Thyroid.
That's your thyroid gland. Right and left lobes and the isthmus that connects it. Okay. What sits above the thyroid gland?
Thyroid cartilage.
Thyroid cartilage. This mass right here is your thyroid cartilage. Okay. Making sense? Oops. Next one. All right, again, if you look real close, you can see this structure right here. Put on the highlights. So it's this big blue structure right there. Okay. You can see it coming down. So what would this be called?
Kidney.
That's your kidney. Okay. It's kind of shaped like a kidney bean. You can easily tell it. What's this structure on top of it right here where the mouse is?
Suprarenal gland, adrenal gland.
Suprarenal gland or adrenal gland. I didn't see anything else. And coming down through here, this is your abdominal aorta. That's coming down right down through the middle of it here for your blood supply. And your vena cava going up. All right. All right, so that gland's been reflected up. And what is that?
Stomach.
That's your stomach. And Norm is laying down. They just pulled it up so you can see underneath it. So that's your stomach. And again, you can see the small intestines here. You can see the pancreas. You can see the spleen. You can see the liver. And look at this thing right here. Follow my mouse. See that thin ribbon right there? What is that? Stands all the way across there.
Diaphragm?
Everybody see what I'm pointing? Yep, that's the diaphragm. That's your mushroom-shaped muscle that controls the thoracic cavity. It allows you to breathe. It allows the increases the size of the thoracic cavity so air can flow in. That's your diaphragm. It's the muscle that extends all across here. It's this huge area here, and that's your diaphragm muscle. Yeah, I'm trying to think what else you see on that, but what it's pointing to there is the stomach. All right. Before we answer, is this male or female? And how can you tell?
Female, because there's no penis or testes.
Perfect.
And it's inside.
And it's inside. What's present there that makes it a female? You're right. There is no penis or testes. So it's lacking that. But what's there that you can see?
Uterus.
Okay, you can see the uterus. You see these little, what are these little egg things right here? This one here and this one here.
Ovaries.
Those are ovaries. So you know it's a female. Yep, perfect. And you want to know what this little tube is that's going right there. Let me turn the highlight back on. So it's that little section right there. What is that called?
Fallopian tube or uterine tube?
That's the uterine tube. And this is on the right side. So it's the right uterine tube. Right? Or it used to be called the fallopian tube. Same thing.
Is that the same as adrenal and suprarenal, and then vas deferens and ductus deferens? You'll accept fallopian if
you write it in for like the practicum, yeah, I'll accept it because it's the same thing. They get together and change the names because it makes them feel good sometimes. I think to change the name on things. They had a meeting. This was about 4 years ago now. The chemical engineers, associating of chemical engineers, got together in Switzerland. They spent $3 million to change the name from aluminum to aluminium. So the official name on the periodic table of Al now is aluminium. It's not aluminum. $3 million in a whole weekend in Switzerland to determine that. So, but I think people still call it aluminum anyway. So, you know, it's 6 or half a dozen, one or the other. It makes no difference. But yeah, they get together and change names because it gives them something to do sometimes. But that is your uterine tube or your fallopian tube. All right, this is a tough one. What sits on top of what's that big structure here that's this thing sitting on top of? Everybody should recognize this big thing right here that filters all your urine from the body.
Kidney.
That's your kidney. What sits on top of the kidney?
Adrenal glands.
Adrenal glands or suprarenal glands. Perfect. So there's your adrenal glands. So you see if I can click it on here. Okay. So that's an adrenal gland. And again, we're looking at a female body. Okay, for the apparent reasons. And what is that arrow or that white line pointing to? That's a little egg-shaped sac there.
Ovaries.
Those are ovaries. Perfect. That's your ovary. Here's your uterus right here. The broad ligament as it holds its uterus in place. This is this right here. We haven't got into that yet. And the urinary bladder sits up behind it. But we'll get into all that later on in one of the chapters. Number 9, cross section. I can't see what it's pointing to yet, so let's make this bigger. All right, now you can see what it's pointing to. Okay, let's get it. Identify a couple of things here so we know what we're looking at. Okay, let's look at this. This is your brainstem. Okay, let's go back to our neuroanatomy for a second. What part of the brain is this? This is what?
Cerebrum.
Not the cerebrum.
The cerebellum. Cerebellum.
Perfect. The cerebrum's up in here. This is the cerebellum. And remember the arbor vitae? These branches come here, the tree of life. You can see all the different branches. It looks like a tree, right? That's where you got the name Arbor Vitae, the tree of life, and those divisions up there for it. Okay. What is this opening right where my dot is?
Is that the aqueduct of the midbrain? Or the
Close. This is the aqueduct of the mid right here, and it feeds into the what?
third ventricle? Fourth.
Third ventricle is up here, first and second, third. Aqueduct of the midbrain, like you said, and the fourth ventricle is right here. Feeds in the cerebellum. And what's this swelling right here?
Pons?
That's the pons, right? The brain. And this is the, what part of the brainstem?
Medulla oblongata.
Medulla oblongata. That's the one that alligators get real mad because they have so many teeth and no toothbrushes. Yeah.
That's what Mama said.
That's what Mama said. Yeah. Hey, with the way school's going nowadays, we might get a lot of that. All right. So let's look at the structure here. So if we look at the structure, look around it and identify what's in front of it. What's this thing right here? This little egg shape.
That's a pineal gland?
It's pointing to the pineal gland, right? But in front of it is a thalamus. This is your egg shape right here. This is a thalamus. If we turned on the highlight, let me turn on the highlight. It'll show you just where I'm at. So we'll turn on the highlight there. That's what they're trying to get you to identify. So this is your thalamus. And then right distal to the thalamus is your pineal gland. Like I said, the pineal gland is responsible for producing what?
Melatonin and maintain circadian rhythm.
Yep, perfect. There's your circadian rhythm. So that is the pineal gland. Now let's see if we can find the other ones that they want. We found the thalamus, the hypothalamus, and the pituitary gland. So this is your thalamus. So the hypothalamus means below thalamus. So this is your hypothalamus right here. Okay. And this connects through the stalk to the pituitary gland, which is right here where the dot is. That's your pituitary gland. Okay. Perfect. And anything else we can see on there? That looks good. Okay, what structure is highlighted here? You see the, I'll take the highlight off for a second. You see this band right here.
That's
What
a
gland with that? What's that?
pituitary gland?
That's the pituitary gland.
I thought that would be like ripped off when you take it out because
I know. I thought it was encased in the bone. It got pulled out.
there's still a cursive circuit.
It is. But if you go into the skull with a saw and cut that bone away and then pull the brain out after that, you can get it out. But you're right. It's a case of cella turcica. So when you just pull the brains out for mass things, they get lost in there. But you're exactly right. But it is a case of cella turcica. But if you go in and dissect it with like a sawzall, I mean, it's a little sawzall, but it's a sawzall. You just cut around that and you scoop it out and pull the brain out with the whole thing intact. Because you look at it, let's look at this. This is your cerebellum here. And you see these two little bumps right there. What are those? See these two little bumps right there. That's your quadrigemini. Those are the 2 months. These are either the superior colliculi or the inferior colliculi. I can't tell which way it's going because you can't see up underneath there. Okay, but it's either your superior colliculi or your inferior colliculi. Okay, because here's your optic tract, your optic nerve feeding down into there. And this is the, what are these things called right here?
The lobe, something lobes.
Olfactory lobes, then olfactory tract. That's your first cranial nerve. That's your sense of smell. So this is cranial nerve number 1, olfactory. This is cranial nerve number 2, optic. And this is your pituitary gland. And where are we at? Pituitary gland right there. See, those are your olfactory bulbs. Hypothalamus you can't see, it's underneath there. And the pineal gland you can't see either. But you can see your cerebellum, you can see the cerebrum, you can see the pons right here, and you can see the quadrigemini right in there. Perfect. Okay, male or female?
Male.
Okay, everybody should get that right. You don't need anatomy for this one. And what is this structure here? It's pointing to that tube right there.
The epididymis.
Okay,
Or
that's the
the
epididymis. What's that? The epididymis that connects there from the testes. And the ductus deferens used to be called the vas deferens. As you pointed before, after that. Okay, we haven't gotten into that chapter yet, but we will. But that's your epididymis. Again, this large organ right here.
Liver.
Perfect.
I've been wanting to ask, what is underneath the liver? What is that, like black, green, whatever object?
I don't know. I saw that too. I'm not quite sure what.
Because when it's highlighted, it doesn't highlight that. Could that be liver cancer?
It looks like necrotic tissue. That's what it looks like it's gangrene. That's part of the liver.
Mm-hmm.
It could be cirrhosis of the liver.
Like the beginnings of cirrhosis?
Yeah, but the rest doesn't look too terrible. You got the
even like the bottom lobe of it, you can see it's kind of like scarred or it's starting to.
Yeah, you can see the tissue distal to it there. It looks like a disease state. It looks like a mass that's growing on the liver, something that's been necrotic from underneath it.
And the liver can regenerate, correct?
No.
Tissue.
Don't
okay.
think the liver can regenerate.
Okay.
I know ribs regenerate.
What was that?
Ribs can regenerate. You break a rib, you can grow a new rib, actually. Ribs can grow back. Ribs can regenerate. It's really interesting. Because we'll use ribs a lot of times with Marines that have been in trauma to the face. They've blown up part of their mandible. We can actually take one of their ribs and shape it and form a new mandible for them and wire it into place. It will grow, it will fuse as a new mandible and it will grow back. The rib will actually regenerate. I don't think livers regenerate. I will double check though. You might have a limited capacity. I don't.
I heard it somewhere and
Yeah. I'll put a little note here. I don't believe it does, simply because when people get cirrhosis of the liver, like alcoholics, that's fatal.
Yeah.
So I don't think it can regenerate, but I'll double check. But I think that black area is a disease state. That's not normal. Okay, that's the area that could be gallbladder cancer too. That's the area of the gallbladder. But gallbladder is not that big, not near that big. So it could be some disease state in there, but we'll check that. But all that looks good. So that's our liver. Other questions on that? Those are good questions. All right. Let's turn on the highlights. That area right there.
Isthmus of the thyroid.
Okay. Because here's your right lobe, your left lobe, your pyramidal lobe of the thyroid, and the isthmus is what connects us. Now, if you look at this, you can see the thyroid cartilage. Okay. And this is this is where you do your puncture right here. This is where you do cricothyroid membrane puncture. Okay, if someone's choking when you're working the RN on shift, you take your scalpel and that's where you put it, right there, right between the Adam's apple, that groove. You can see there's nothing here. There's no blood vessels. Okay, so you just put a scalpel in there and twist it, and the patient breathes if they're choking on something. Big thing in hospitals, you give a patient aspirin, they're allergic to aspirin, the tongue swells up. It's called Ludwig's angina. Tongue swells up, blocks your airway. If you don't do that, they're going to die. We get near it. So you just take a scalpel or anything sharp, okay, puncture right here, and they're going to breathe. It allows air to bypass the oral cavity up there. What else we got here?
I have a question.
What's that?
When they remove and do a total thyroidectomy, do they take the thyroid cartilage as well, or is it just the actual thyroid and parathyroid that they take?
Depending on the why they're taking it out and what's spread. Normally, if the glands are fit, they take the thyroid gland only. If there's been disease that has spread into the cartilage and interwoven in it, they'll take part of the cartilage out too. But they try to maintain that because that helps support and protect the trachea behind it.
Okay, thank you.
Sure. But most of the time, it's just the thyroid gland. But if it's been cancerous or the disease has spread, they'll go there and they'll take the whole area out just to make sure. And here you can see, if you look close, right below here, this area right here, this is your trachea. Okay. And if you look at it, you'll see these little lines. You'll see a line here, a line here, a line here. Those are your cartilaginous rings. The thyroid is a tube, but it will collapse like any other tube in the body. So it has these cartilaginous C-shaped rings that permanently keep it open. Okay, and we'll talk about that when we get into the next. I think it's the next chapter. We'll talk about the cartilaginous rings of the trachea. Okay, everything else looks good. Perfect. But that's the isthmus. Close that back up. Isthmus of the thyroid gland. So right lobe, isthmus, there it is, isthmus of the thyroid gland. Okay, another one here. Okay, what organ's highlighted?
The lung, no, the heart.
I was gonna say the liver, but no, I'll agree with the heart. That's the heart. Like I said, we haven't gotten to the heart yet, but we have a whole chapter dedicated to the heart. And you'll learn all the intricacies of it, all the different parts of it, how it works, how it functions, how blood flows through it, and everything else. But that is your heart. All right, again, another difficult one here. Shaped like a bean.
Kidney.
That's your kidney. Okay. Let's see. I don't even see the spleen. I don't see the pancreas, but I do see the adrenal gland. You see the adrenal gland on top of each kidney there. That is your kidney. All right. This one's tough again.
Another kidney.
Another kidney. Okay. And on top is the adrenal gland. Yep. All right, the highlighted structure is part of which endocrine gland? Okay, so it's not asking you for the structure, but I'm going to ask you, but what gland is that part of?
Thyroid?
Okay, that's your thyroid gland, right? Here's your thyroid gland. What is the structure it's pointing to? This little area right here. Let me see if I can highlight it. Okay, that little structure, what is those called?
The left lobe of the thyroid.
Above the left lobe. The left lobe is below it. Those little structures called above it.
Is that one of the parathyroids?
No, when parathyroids are behind it, you can't see it unless you take the thyroid out.
The inferior, no.
The what?
I was going to say inferior thyroid artery, but
no. They're part of the gland. It's part of the left lobe of the thyroid. Remember the pyramidal lobe? That's the pyramidal lobe of the left thyroid. There's a pyramidal lobe on the top, right above the right and left thyroid. Each lobe has a pyramidal lobe right above it. Okay, and it's part of the thyroid gland.
Pyramid. I thought you were saying pyramidal.
Pyramidal. The pyramidal gland. It's pyramidal or pyramid?
I think you're saying it pure. Yeah, think you're saying it right. It says, I heard peer, like P-E-R, middle.
Like the Egyptian pyramids. Pyramidal. Pyramidal is just a shape. Yep. So that's a pyramidal gland of the of thyroid, but it's part of the thyroid gland. Okay. And the parathyroid glands are circular. They're like little dots that were painted on the back of the thyroid. Okay. If we look here, okay, what gland is that pointing to?
Wouldn't that be
The what?
the adrenal glands? No.
Yeah, the adrenal glands. Perfect. Here's the kidneys, and that's your adrenal glands. Those on top of your suprarenal glands. But that's not the question. The question says, but it is the adrenal gland. It says, what class of hormone released by the highlighted structure increases blood glucose?
I'm going to take a wild guess on this and say glucocorticoid.
Glucocorticoids would increase blood glucose. Okay. Okay. It's the one that has glucose in it. Androgens are testosterone, things like that. Catecholamines are neurotransmitters. Mineralocorticoids are for water balance, water control, and your glucocorticoids for sugar balance. That's all released by the suprarenal gland. Again, that's from the medulla area of it. And 19. All right. What organ is this?
Liver.
That's the liver. And that big black thing is got to be some disease state of it. The highlighted organ secretes which of the following hormones in response to growth hormone? We did not cover that. I don't think we did cover that.
Is it ADH?
I was going to say too.
Antidiuretic hormone?
That, yes. Mm-hmm. Yep. I don't know. Diuretic is water, isn't it?
What's that?
Diuretic would indicate water.
Right. We talked about the antidiuretic hormone. Antidiuretic hormone increases the kidney to retain water. Okay, to help increase your blood pressure.
I found it. It's on page 522. So
Yeah.
we did go over it, I think.
But did it say ADH?
It's
No.
IGF-1.
IGF-1, interstitial growth factor, would be the one that would do it. Yeah. Okay, but I don't know if we can cover that in class. So I wouldn't hold you responsible for that. And if we look at this, what hormone is secreted by the highlighted gland?
Melatonin.
Is that the pineal gland?
Yes.
Yep, pineal gland and melatonin. Perfect. What structure is highlighted here? It's pointing to
Stomach.
Stomach.
that's the stomach. So you should get all these right. Might come in a little different order than it was before. Okay, that is the what?
Left uterine tube.
I was going to say, I thought it was pointing to the order, but let me check. Let me turn on the highlight. Yep, tube. Left uterine tube. Okay. Go through these. And that is the
Kidney.
kidney. This is the,
Heart.
it's kind of hard to tell with the highlights on. Yeah, that's the heart. And what's that arrow pointing to over here?
Kidney.
Kidney.
Kidney. Perfect. And that is the tube that connects the testes up into the penis here is the
Epididymis.
epididymis. And this is this organ here.
Pancreas.
That's your pancreas. And the pancreas is one of the only organs that's exocrine and endocrine. Secretes into the small intestine through the duodenum, into the duodenum, and increase into your bloodstream. And that is the
Thyroid.
there we go. Yep, that's your thyroid gland, but let's make sure that's what they asked for. Yeah, thyroid gland. Looks like it's pointing to the gland. And what gland is that?
Pituitary.
Pituitary. You're right. It usually does come off. You take the heads off, but take the brains out, but you have to dissect the salicaturus away from it. And that is the blow it up here a little bit.
Thyroid gland?
Yep, that's
the cartilage above it.
Yeah, the cartilage is above it. That's almost like a heart shape above it. That's the thyroid cartilage above it. And the butterfly gland, you see the right lobe, the left lobe, and the isthmus that connects them of the thyroid gland. So thyroid gland. There we go. Yeah, this is a little bit different. We didn't get this last time. That's where it's pointing right there. And that is the, what?
Thyroid gland.
Thyroid gland. They like the thyroid gland in here, don't they? And the kidney. They like those two things. Make it a little bit smaller. There we go. And they do like the thyroid gland.
Right lobe of thyroid.
Right lobe of the thyroid gland.
Or is that the pyramidal?
No, the the pyramidal, the pyramidal, that sits above. The pyramidal would be right. Let me show you. The pyramidal is right here. See where the dot is? That's your pyramidal, the top portion, right? Oh, you see it better right here. See this little flap right here?
Oh, okay. Yeah.
That's the pyramidal portion of the thyroid. The little flap that sticks up above it as part of the gland. You really can't see it much here, but it's located right in this area. But that's the pyramidal of the left lobe. This is the left lobe. That's the isthmus. That's the right lobe, and the right pyramidal gland part is right there. It's not here, but the left side you can see real well. Again, you can see that real well right here. Does that make sense?
Yeah.
All right, perfect. And right lobe of the thyroid gland. All right, and that's pointing to the
pituitary? No.
Because look
yeah, pituitary.
Yeah, here's your thalamus. Here's your hypothalamus. Here's the infundibulum, and it connects to the pituitary. So there's your pituitary gland. And that's pointing to what?
Ovary.
That points to the ovary. And that's your, what's that one?
Liver.
That's the liver. Yeah, this is a new one too. We didn't have this last time. What's that pointing to?
Pointing to the optic nerves.
What number cranial nerve is that?
2.
Yep, that's the second cranial nerve. That's your optic nerve tracts coming down right in front of the optic chiasm. So there's your optic nerves. Okay. Now, which hormone is released by follicles of the highlighted organ? What's the highlighted organ?
Ovaries.
Ovary. What does the ovary release?
Estrogen.
Estrogen. Releases estrogen. And the hormone secreted by the highlighted chamber of the heart acts to, so here's the heart. This is the right atrium of the heart. And the hormone secreted by it either increases heart rate, increases blood glucose, increases sodium excretion, or increases sodium resorption by the kidneys.
You say increased heart rate?
Increased heart rate, that would be the AMP. What does it? Well, it increases sodium excretion by the kidneys. Okay, it acts to, now think things through. If it increases sodium excretion, you're getting rid of salt. Water follows salt. So you're getting rid of water. So it's the opposite of the antidiuretic hormone. So it acts to do what to the blood pressure. If you increase your sodium excretion, well, how's it going to affect your blood pressure? Think of your blood vessels as a tube with water running through there. Okay. If you increase the amount of water in that tube, you increase the pressure, right? If you decrease the amount of water in that tube, you decrease the pressure. So the water is being taken out of the body by taking sodium out, because water follows salt. If you excrete sodium, you excrete water. If you retain sodium, you retain water, because water has to dilute it. So you're getting rid of water, so your vessels are getting less water, less volume in them. So you're decreasing your blood pressure. So when that hormone is released, which is ANP, okay, it reduces your blood pressure, brings it down by increasing the sodium excretion in your kidneys. That's what the function that it does. Okay. Okay. Again, which of the following hormones released by the highly? Did we just do that? Oh, different hormones now. Okay, what structure is it pointing to?
It looks like the ovaries, but it could be I don't know if it's going all the way. It could be the tubes.
Nope, it's the ovary. It's pointing to the ovary. Yeah. So what is the ovary? Progesterone, follicle-stimulating hormone, growth hormone, or luteinizing hormone?
Progesterone.
Progesterone. Okay. Estrogen and progesterone are released by the ovaries. It gets the body ready for the implantation of the fetus, of the egg at that time. All right. This one, what gland is that pointing to first of all, so we know where we're at?
The thyroid.
Thyroid.
Perfect. Thyroid gland, the common one here. We all love the thyroid gland. Okay, without the presence of iodine, okay, which hormones would the highlighted gland be unable to produce?
T3 and T4.
Perfect. T3 and T4 if you don't have iodine.